You guys don't have to tell me who's here because we'll run the Excel report and then we'll go from there. So first exam is always gonna, all our exams are 50 questions, 5 math. Make sure you guys have a whiteboard for your math so you can work out your problems on the whiteboard. You guys have a study guide that your teacher should have given to you, so make sure that you have that and you access that. My best suggestion to you is listen to the exam reviews the professors do. That's been where I've seen the most success. So just because that's the way it is. So the way I'll run mine is I make a PowerPoint to present to everybody so that you guys can follow along. Jot down some notes maybe as you see the PowerPoints, if there's something on there that I bold or I emphasize, okay? If you have any questions, feel free to just call out or write them in the chat and I'm happy to answer them, okay? Any questions before we start about the test format? Yeah, 50 questions, 5 math. Just make sure your math is under wraps because that's 10 points on the test, 10 points on the actual test. So, all right, I'm going to start in just 1 minute, just see if anyone else joins us, okay? You guys don't have to have your cameras on if you don't want to during this. Oh, well, then you won't. Well, I don't know how Zoom usually doesn't take your attendance, but at least I have who's here. And I'll make sure that gets to professors that you guys were here, okay? So let's start. The first thing we're going to look at here is I'll share my screen with you. And the reason I do a PowerPoint is to sort of help you guys, try to help you guys see what we go over that we talk about. So let's take a look at this. And on your study guide, a lot of this is there for you, but it's in question format. So I try to give it to you in answer format. Okay, so let's take a look here. Let me just get back to my Zoom. Make sure I let everybody in. Okay, so we're going to take a look here. The first thing we're going to look at is, what do we look at when we're looking at community, right? So when we're looking for evaluating community, we're going to look at lifestyles. We're going to look at health status and knowledge. What do we know? What do we not know? Okay, so that's how we're gonna do it. So we look at things in our environment, such as playgrounds, lights in the street, driver programs, all that stuff that's going to keep our community safe, right? So that's what we look at when we're evaluating a community. You guys had 3 levels of prevention that you looked at as well. We had our primary, our secondary, and our tertiary. Okay. So when we are thinking about our 3 levels of prevention, how are we going to have this come into play when we do planning of care with children diagnosed with a chronic condition? How is this gonna, if they have a chronic condition, what should we think right away?
Long-term.
Good. Are we going to be doing something preventative? Are we going to screen? Or are we going to treat once we have a chronic illness?
We're gonna treat.
Yep. So anytime you see a kid with an illness and we're doing anything with them, we're treating them, right? So when it comes to smoking in children with chronic conditions, particularly like our asthma, how would we do primary prevention? Who are we going to teach to?
The parents? Or no? Wait, it's primary with asthma, but they already have asthma?
So who are we going to teach to? Are we able to teach to them at this point to make it primary?
No.
No. So you were on to something, but I want you to think about what parents would we be teaching to?
Babies and toddlers?
Yeah, those kids that don't have chronic conditions yet. Okay, so if the kids already have chronic condition, what could we do for them that might be primary though?
Would it be how to use your inhalers?
So somebody help Chris out. Use your inhalers. What's that? What level is that?
Treat.
Tertiary.
That's treating. What we could teach to kids with chronic illness, say like asthma, is something like healthy eating, right? Because healthy eating has nothing to do with the asthma. Does that make sense?
Yeah.
So when we're trying to treat a kid with a chronic condition and we want to do something primary, could we teach them about MMR maybe? Right? Because that has nothing to do with asthma. But they have, just because they have a chronic illness doesn't negate that they're children, okay? What we could do for tertiary prevention, if somebody has asthma and smoking, what are we gonna teach those parents?
Mi amor, mamá no puede, mamá está ocupada, cielo. No.
What are we gonna teach those parents?
To treat it, like how to teach your kids how to use the bronchodilator or to look for signs and symptoms if they're having an asthma attack, maybe.
Yeah, what are we gonna tell those parents? Are we gonna tell them keep on smoking in front of your kids? No.
No, get rid of the cigarettes, smoke
Right.
outside.
I mean, smoking outside, what they've come to find is cigarettes on clothing even impacts kids. But yeah, I mean, really what they teach in the NICU a lot of times is if there is a smoking parent, they'll tell them to change their clothes when they're around the baby, right? I don't know that gets rid of it, but if you're not, you want to teach them not to smoke, right? You want to try to do those things, but once they're already doing it, we're tertiary prevention by teaching those parents, all right? Know that our public health focuses on all this, right? Disease prevention and health promotion. We have two different insurance companies that we talk about federally. We have Medicaid and Medicare. Our Medicare is going to be for those people 65 and older. What's happening with Medicare right now is our baby boomers are taking over Medicare, which is a good thing. They've earned it. They're over 65. So it is having a real impact though. I just heard recently Medicare may up it to 70 because we have this large generation that's, being funded, one of the biggest generations that's hit Medicare at this point. Medicaid, okay, remember, is aid. And who are we giving Medicaid to?
Low income population.
Poor people.
Say that again, Eric.
Ya, la que lo unto. Poor
Okay,
people.
low
people
income,
don't have-
and what else? What else other than low income?
Does that fall under disabilities?
Yep. Medicaid will be to some of those that are unable to work. The permanently disabled gets a little furry, so don't worry about that. But what we know is those people that are not able to work or are disabled, okay? We're gonna give them their Medicaid. What we know about the health costs in the United States. We spend a ton. We don't see any benefit.
It's expensive. Health cost is expensive.
Yeah, it's really expensive. And what we see is with other countries that spend the same kind of money, they have better outcomes. So we spend a lot, but we don't always see the benefit. Social determinants of health are those things that are gonna determine, and there's a little picture here from Healthy People 2030. What kind of things are gonna determine if you're likely to get illness? My class, we just went over this.
Your income level,
Genetic, environment,
Good, environment, economics.
lifestyle.
Yeah, your social context, who you're around. What about this one?
Yeah, education.
education, access,
neighborhood.
Yeah, and the lower the education, the poorer the health outcomes. Okay, so the lower the money, the poorer the health outcomes. We have accessibility to health and quality. And so think about those cities where we have the top hospitals, and then we go to these rural places where they're called community-based hospitals. They don't have the best surgeons, all that kind of stuff. Okay, so those are really important. We have an act that we did not talk about in my class, but I hope you guys know about. It's the Affordable Care Act. Anybody know who passed it?
It's
Was that
Obama.
Obama?
Barack Obama.
Barack Obama.
Obamacare.
And what he did was he did this because he wanted everybody to have access to health care. There was a lot of publicity about it. You guys are young, so may not remember, but I remember it, and everybody was they always try to get to politicians in healthcare. A good thing about it was he increased Americans who could afford healthcare. He increased quality and lowered the cost. Okay, these are important things that the Affordable Care Act did. But here we go again. I'm going to emphasize this again. Our healthcare costs, excuse me, in the United States are the highest in the world, but our indicators of health are not great. So we spend a lot, but we don't get a lot out of it. Sorry, I just need some water. So I'm going to emphasize to you again, something on your exam that you may see is something about healthcare cost and outcomes, right? We saw that twice now. All right, we had a section on school nursing. I was not able to get to this with my class, but really what I want to emphasize with school nursing is this. It's a fabulous field. I love it. You get holidays, weekends off, you get good money, good pensions. I love it, but I've done lots of things in my career. So at this point, I've done everything, and school nursing is a good place for me to be at. But what I will tell you is we are going to be looking at things on a kid, ABC. Airway, breathing, and circulation. Remember that for any patient that you ever see. So airway, what kind of kid are we going to see in a school nurse's office that's important?
Asthmatic.
Asthmatic.
What else?
Diabetic.
Yeah, diabetic for sure. Think about airway. What else other than asthma?
Allergies, like peanut allergies or
Beautiful. Anaphylaxis, right? It's going to close their airway. That is a priority. Our asthmatics who can't breathe, our anaphylaxis reactions, and then we look at breathing. Are they wheezing? Are they something cardiac going on, right? So we go down our rules of thumb, just like any nurse would. We're going to encounter some things like pink eye. We're going to have lice. We're going to worry about obesity. Big thing with our school age kids is obesity. Okay, we're going to think about our ADPI and priorities and interventions. And we just kind of talked about that a little bit, right? And so how are we going to teach? Primary, we're going to be educating our healthy kids. What kind of screenings do we do in the school?
Scoliosis, vision, hearing.
Yep, all those. Vision, hearing, scoliosis. So you're going to screen for those. Let's see what else. School nursing, other thing we want to look at is Healthy People 2030, what we looked for in nursing. I mean, in schools is we really want to, this is a big, big one. We want to reduce those numbers of days that asthmatic kids are out. Because a lot of parents, anybody who's in school nursing knows this. A lot of parents say, oh, they have asthma. They can't come to school today. It's cold. Oh, they can't go outside and get fresh air. Well, we know unless they're a real acute case that these are healthy lifestyles for a child. And so we want to promote them bringing the medication to school so the kid can be in school, right? And then we give them their asthma treatment, whatever they need every 4 hours or before gym or whenever. So things to think about. Vaccine coverage, we're always looking to increase that in kindergartens. Let's see what else. School health to prevent things like we know this. We've talked about this is going to be our primary prevention. Tobacco use and addiction in our elementary schools, alcohol or drug use. We're going to be screening those teenagers, right? Not necessarily always, but when a teenager comes into our office and they seem impaired, we're going to screen them. Right? What kind of screening do you think you're going to do on alcohol or drug use?
a P test?
Unfortunately, we're not necessarily, unless you have a doctor's order, can't do that.
Neurological, you'd be
Good. Give me some examples. What do you think neurological?
I'd run a nice Stagnus test on them if they were drinking.
Excellent. The eyes, remember the eyes will go like this if they're drinking.
A twitch,
What else do we look for?
pinpoint pupils.
What, and for looking at marijuana, we know that we see bloodshot eyes, right?
Mhm.
We'll do alert and oriented, right? Because sometimes they may be alert, not really oriented to their teacher or to where they are or what they just did. Okay, so we want to be really careful about that. We know always STDs, we're worried about our teenagers. What is the biggest thing we worry about with teenagers is going to be suicide and our car accidents. Okay, Unfortunately, mental health has really deteriorated across this country for many years, and we're at a almost crisis situation with our teens. Okay. We have 4 different things I want to talk about when we look at our acts that we look for medical acts. We have our Family Medical Leave Act. Anybody know what that is?
Allows you to take off work to be with like a newborn or take care of an infirmed family member and still be able to retain your employment.
Good. It's not necessarily going to get paid. That's company by company, but they will hold your position, right? So important to remember. World Health Organization, what do? They regulate our worldwide events such as the pandemics. We just survived a pandemic, so we all know about our World Health Organization. We have American Disabilities Act, right? It was passed in 1990, and it's to make sure that everybody has their rights. Okay, because if you have a disability, it does not mean that you should not get a job. If you have a disability, it does not mean you should not be able to buy a home. If you have a disability, it does not mean that you should not live in a community that doesn't have wheelchair access. It doesn't have bars and showers, all that stuff, right? Then we have one that is not federally moderated. I want to emphasize this again. Your QSEN, your Quality and Safety Education for Nurses, is not a federally moderated, okay? It's what it does is it helps us as nurses and our education. So does everyone understand why that would not be federal? Because honestly, even our nurse practice acts, those are state by state, right? The nurse practice acts are the ones that tell us what to do. So what this does is the Quality and Safety Education for Nurses is a general organization that's going to help with quality improvement, so getting things better, evidence-based practice, which we'll talk about in a minute. What do we know about evidence-based practice? What is another word that we can use for that? Well, it's evidence. What does that mean?
It's worked before.
Facts.
It's
Say that again, Eric.
Data?
Good.
Yes.
Data, right? It helps to us as nurses generate new practices, right? Where do we get this evidence-based practice from? Who generates it? Where do we get it from? It's evidence, it's data. What should you think?
From the clinics.
So from things like studies,
Sorry.
from papers, right? That are
Research.
based on, research. We know that our focus with quality and safety education for nurses is always patient-centered care and safety, right? You'll see a lot of evidence-based practice with our computer and our ITs. So here's a little picture about evidence-based practice. So it's use of current best evidence in making decisions. How do we get what the best case studies are? I want you to know this. Your highest level of evidence-based practice is going to be qualitative studies. What do we know about qualitative studies? Anybody? I think Chris is talking, but he's muted.
Qualitative is more about the content contained within rather than the amount.
Right, and qualitative, you're going to have repeats. Okay, so if you look at the ones above it, case controlled reports, no, we don't want to have a case control. It's not going to be as thorough as if we have several different types of studies, put them all together and then say, well, this has come together, right? So those are our systemic reviews that we do. Okay, qualitative studies is our highest level. All right, what is very important with evidence-based practice, we got to figure out, why are we studying it? What are we trying to answer, right? That's our question. What are we trying to answer with this evidence-based practice? Any questions on that? I want you to make sure you are aware of our highest level and why we're doing it, okay? So I emphasize that and I bolded it for you guys. All right, our next thing, my mouse is acting up. Hold on. Come on. There we go. All right. We talked about in our class and in your classes, community-based or nursing, community-oriented. The way I like to think about this is community-based has a base to it, meaning you have something wrong, you got to work on it. Okay, so you have this base, this illness, chronic condition, and you want to work on it. So we're going to do our chronic care, we're going to do our acute care. You know, care is usually provided in places where people live, work, and attend school. Okay, why would any nurse be in public health? Everybody says this. Why would you want to be in public health?
To help the
So you-
community.
Good, help the community. Why else?
You want to get to, you want to prevent disease before, you want to get to the people before they start the bad habits.
For sure. You want to get to those people. Think about the autonomy that goes with public health nursing. You're going into somebody's home, usually by yourself, right? You are a community-based or a church-based nurse, you're going to do that. School-based nursing, I will tell you, you're the only school professional in a building oftentimes. Think about those community-based facilities and why that autonomy might be nice. Everybody remember autonomy is you kind of do it on your own. Doesn't mean you don't work with other nurses, don't mean you don't confide in them and call them and say, hey, what would you do in this situation? But you're responsible for an entire place. And then, so it gives you some real independence and some autonomy. One thing that we see, and I threw this in here because it's something I want you guys to remember, with our kids with chronic illnesses, we always want to make sure they have a medical home. Does everyone know what a medical home is?
A
The
primary care.
term, but I don't know what that, like, what the establishment is. So
A
I hear
PCP.
people refer to it a medical home.
Good. KCN, what do you think a medical home is?
Primary care physician.
That's here.
Okay, so it may be a primary care physician. Tell me a little bit more.
Could it be someone's actual house where they're getting their, because they have a chronic disease?
So you're almost there. You're thinking on the right path lines, and so is Casey when she says primary care physician. You want somebody that has all the records for this chronic person and can help coordinate care. So that's your chronic home, your chronic medical home when you're looking at that for kids with chronic illness. It's called a medical home. It's a doctor that is in charge of everything. So he's kind of like, you know, he puts the tent up and everything falls underneath him. Does that make sense to you?
Yeah.
Very important. And the reason is because these kids have a lot of needs. You don't want any of the needs to fall by the wayside, right? So you want to make sure that you're paying attention to them all. So 3 little topics here that I threw in. We talk about community-oriented nursing as opposed to community-based. I told you community-based, you have a base. You got something that you're dealing with. Community-oriented is more like, let's help everybody, like Healthy People 2030, okay? So our goal is, like we've heard in the review, prevent disease and disability. We're going to focus on the healthcare of individuals. We're going to make everybody happy and healthy. We're going to survey the public. We're going to do all this kind of stuff. So you're oriented more towards the whole community, making everybody happy. Does that make sense?
Yep.
Because I need you guys to know the difference between the two. You will see something that will pop up about this, okay? So I mentioned Healthy People 2030, and we look at health disparities, and I know this is really small. So let me see if I can do it this way. There's like a ton on that slide, so sorry, my mouse is really misbehaving. Okay, so when we look at our vulnerable populations, what do we know about our vulnerable populations? I put pictures here to help you guys remember. So we got our homeless guy here. We got the one who's hanging out the clothes to dry, carrying water from wherever, right? So these are our vulnerable populations. And we know it's a subgroup that is going to get more health problems because what they're exposed to, right? So what are we going to see in these type of communities? We're going to see multiple transitional housing, right? Because we're going to see lots of in and out. We're going to see stores and homes that have bars with them, more susceptible, right? We're going to see homeless in these vulnerable populations. There's a lot of things that we look at when we're looking at a vulnerable population, okay? They're very unique groups of people. And so what we want to look at there is we want to see financially, how do they manage? What's their diet and exercise look like? What genetics do they have behind them? What social hazards are they exposed to? What environmental hazards are they exposed to? Cold, like think about the homeless, cold, water, contaminated water, those kind of things. So when we look at this group, and I want you to think about this generally, we're going to assess this group specifically because they have have a lot of limitations with these different pieces. So we're going to look at money, we're going to look at food, we're going to look at genetics, we're going to look at social and environmental. Okay. Please know those 5 things that we look at with our vulnerable population. Any questions on that? I can't see you guys, so let me.
No.
Any questions on that? No. Okay.
Nope.
All right. Then what does public health do? We go a little bit, we'll come back to that. Healthy People 2030. Important, important, important. You guys are doing a paper on this next week. What's our goal of Healthy People 2030? We're looking for health equality and our social determinants of health. We're trying to get everybody up and equal, trying to improve that health quality and improve those economic challenges, the educational challenges, the social challenges, the environmental, okay? So its goal is to set national goals and objectives for evidence-based goals, okay? So it's really set objectives for our evidence-based goals. When we look at our goals for Healthy People 2030, I want you to know these, please. Our goals, and I did it this, go ahead.
Sorry to interrupt. On that last slide, what was the third bar? I didn't.
It's just
Oh,
our goal,
goals,
really,
just
our
the
ultimate
goals. Got
goal.
it.
The first one and the last one are the same. I'm
I
emphasizing
got
to you
you.
guys the importance of health equity and social determinants of health.
Mhm.
Okay. So when we look at our goals, what kind of things we're going to do? Now, I want you to try to remember these when you're studying. So we're going to attain lives that are well-being and free of preventable disease, disability, and injury. We're going to try to eliminate those health disparities. We're going to try to create physical, social, and economic environments. We're going to promote healthy development behaviors. And we're going to engage leadership. We want the public to get policies in place that are going to improve the health and well-being of all. Okay? So I know this is a lot on this slide, but I want to emphasize to you again. You want to get those lives free of preventable disease, eliminate health disparities, get our physical, social, and economic environments better, promote healthy development, engage leadership, and improve overall health and well-being. Okay, so I put the keywords at the top just as a way for you guys to sort of make a little note on your cards. We talked tonight about family, and I'm sure you guys talked in your class about family. So I emphasize to you that we respect and whatever our patient's family described is who they are, right? Everybody's unique. Whoever determines your family is who you say. So there's a chart in your book in the family chapter about healthy versus unhealthy, functional or versus dysfunctional. What are some things you think in a healthy family? What are some things that might, and I don't like to use that term, but it's the way the book describes family as healthy versus unhealthy. So what are some things that a family would do that would tell you, looks like they're doing pretty good?
How they communicate with each other.
Okay, so when they're communicating, what do you want them to do?
Everybody gets a say,
Beautiful.
or everybody's listened to.
Yep. There's not one person dominating the conversation. What else?
How they plan their future.
Okay, so everybody's involved in the planning of future. Everybody's involved in what's going on in the house, right?
Leisure time, they spend that together.
Yeah, and anybody who has a family knows that, I mean, you try, right? But think about leisure time may be a religious setting. So going to church, like if you all go to church.
Yep,
Now, it's
they
not
have
to
it.
say that a healthy family, if there's multiple different religions in the house, it can be. But you want to make sure that everyone's respecting, right, those practices and
Right.
beliefs of each other. Okay.
Yeah.
I want you to focus on healthcare function as a family dynamic. Anybody know what a healthcare function of a family means?
Is it? Oh, they take care of each other.
Yeah, exactly. So
Yeah,
if you see an
when
example, it'll be,
someone's-
go
When
ahead.
someone's sick, they take care of each other.
Good. So give me an example.
Somebody gets a cold. Mom takes care of that individual, or dad, or whoever. The parent usually takes the lead, but the siblings could help out if they are of age.
Yep. A lot of times you're going to see the opposite, right? You're going to see the kid taking care of the parent when parents are older. So a grown child taking care of their grown parent, right?
Mhm.
I just heard a term for that, and I heard it the other day, and there's a term for it when you have an older parent in the home and your children are in their 20s, or, you know, so you're still taking care of the kids, but you're also taking care of your parents. So it's called like double parenting or something like that. I just heard the term. I forget
Yeah.
what it is, but
I thought it
interesting
was
that they,
something in relation to roles. Like,
yes, yeah,
it's a
something.
role. Yeah, it's a weird name for how your
Some-
role is reversed.
Yeah, exactly right. So think
Mhm.
about those people that are like in the middle, because they have 20-year-olds who still need parent, you know, help. And then they have 80-year-olds who need help. And then they're like in the middle trying to help everybody, and how chaotic that can get. But we want to think about healthcare functions, big one with family. I like the examples that were given. Please focus on thinking of an example for your healthcare function. Okay. Family crisis is something else that we're going to see on something, maybe a HESI, maybe a test. Family crisis is when people really can't function. Something happens and they say, I just can't do it. Like, something happens to one of the family members and they say, I just can't pay the bills. I can't do this. I can't go to work. I can't function. Okay. That's going to be your family crisis. So it'll become very disorganized, very dysfunctional. That's how you identify a family crisis. Okay. The next section here, ignore. I'm not saying it's not important, but I'm not going to focus on it tonight. It's about how you look at the way a person's made up with genomes and with ecomaps, but I'm not going to spend a ton of time on that. Just know that we look at everything. We look at genetics, we look at environment, we look at all the things going on in a person's family, right? All right, home visits we talked about. Oh, this is so small. So sorry. Let's see if I can make this a bit bigger. We talked about home visits in my class, and here. Why isn't that resuming? Okay, anyway. Home visits. Understand the most important thing we're going to do is understand that this is a great assessment. We can go into somebody's home, right? And we can see what goes on in that house. House communication. Who's taking care of who? Is it clean? Is it dirty? Do we worry? Is the stove on? Is the fridge cold? All those kind of things. We can tell a ton about being in somebody's home. What I would expect you and hope that you would do is, if you go into somebody's home, just like if somebody came into your home, you would respect it. Oh, this might be why. You would respect, hold on. You would respect that it's their home, and regardless how they keep it, we're going to remember that. Before we do anything, we're going to call them and go over what we're doing and why. We're going to find out what's a good time. And we're going to always try to have the whole family there. But what I will tell you in home visits is key is to take time to build that trust among a family. Because if you walk into someone's house and you haven't created that trust, that family is not going to open up to you, right? So know that when you go into a home as a nurse, you're being assessed as much as they are. They're looking at what you're wearing. They're looking at how you speak. They're looking at eye contact. They're looking at physical contact, right? We're going to be very sensitive to our cultural barriers, right? Some cultures don't like touch. Some people don't like to look at you. Some people won't shake your hand if you're a female, or won't shake your hand if you're a male, right? Think about all those things when you're in somebody's home, and you want to do a lot of research about that. So before the assessment, like I said, please know you want to review what's being done. You want to figure out what's a good time. And then what else we're doing? We talked about this a little bit. I'm going to re-emphasize for you. With our infants, we worry about SIDS. We worry about abuse. Who's most likely to be abused as a kid is a 1-year-old. Because that 1-year-old cries. That 1-year-old can't say, I don't like this. The 1-year-old says, you know, the shaken baby happens, right? Because they're trying to calm them down. If they're stressed, you know, those kind of things. So kids, we want to think about our safety, what puts them at, you know, common areas like playgrounds. Those with chronic illnesses, notice where this is coming up again. They have a medical home where all their information is kept. Our adolescents, we're going to have car safety. And suicide is our concerns. How can we help prevent suicide?
Meg, getting resource to that individual that'll help them talk, like giving them the counselors' names, numbers, those groups that can help them.
Yeah, we're gonna, very good. We're gonna give those resources. We're
'Cause
gonna
they're
have
not
people,
gonna get them. They're not gonna
No.
ask for them. They're not gonna
Nope.
go get them. You have to
Correct.
hand them to them.
correct. And you always want to be on, when you're around a teenager, you always want to watch how they say, what they say, and don't say, oh, he's just a kid. Because those teenagers sometimes are looking for somebody to say, I care about you. What can I do? Right? And so stress management techniques, I'm going to emphasize this again. Stress management techniques is going to be a great way to help with prevention. Because if you teach a kid how to cope, once the stress comes, they'll know how to manage it a little better, right? That's probably anybody. I feel like we should have stress management in nursing school, don't you? It'd be so necessary. All right, so think about these are our age-related concerns, important information here. We're going to talk a little bit about guns and safety. And regardless of what your opinion is on guns, doesn't matter. What are we going to make sure? They're locked up. Hopefully they're not in the home. We're gonna make sure that we do not have any mixing of substances, right, with possession. Because they're probably not making those kind of decisions like they should. But particularly around young kids, we're gonna make sure it's locked up, put away. It's on the thingy, I forget what it's called, but locked or whatever. When it's, so that if they pick it up, it doesn't go off. Okay.
Trigger lock.
Yeah, trigger lock or whatever it's called. You can see how much I know about guns, but anyway, that's an important thing. Okay, don't think because a kid knows you have a gun, they're not going to use it, or they're not going to think it's a toy. Unfortunately, a lot of kids have picked up one, not known, and injured themselves traumatically. All right, healthcare decisions with families. I need you guys to know these 4. Dual power of attorney, which is a legal way that somebody designates for someone else to make healthcare decisions when they are unable. All right, then we have our advanced directives, and those are going to be those living wills, durable power of attorney. So remember, advanced directive covers both a living will and a durable durable power of attorney. We have a living will, which lets somebody, when they're fine, to decide what they want to do when they're not fine. And then our DNR, which is specific order that we don't use CPR or life-saving measures, right? So know those 4. The thing to remember is advanced directive covers 2. So I want you to know durable power of attorney versus living will. Okay, so durable power gives somebody the right to make decisions. Living will, the person's made the decisions, so nobody has to make them. Does that make sense? All right, our last slide, I think, is our last slide. We're just going to end this exam review about school nursing. Well, I have one more slide about ethics, but just because I want you guys to know, we are going to always treat emergency medical needs in a school building. We're going to help kids with environmental risks. We're going to teach injury prevention. We're going to do all these things. The whole point is to keep our kids healthy and in school. Does anybody remember on Healthy People 2030? What's one of the big ones?
Keep asthmatic kids from missing classes.
Good. Missing classes in school. And my last slide is on ethics. Okay. We will spend a chapter on this, but I want to present it, and I want you guys to know about the Nurse Practice Act. Every state has a Nurse Practice Act. It tells you what you can do. Does anybody know why we have this?
Is it so you know where your scope of practice is, where your lines are drawn, and if there were ever anything legal to be brought against you?
And why do we do? Why do we care?
Because we are one litigious society.
Well, unfortunately, that's true. But why we care is because our job is to protect the public, right? So if they don't give us guidelines and standards to follow, we're not protecting the people. So I want to emphasize, and I have a bold, and I want you guys to know, what's the point of a practice act is to protect the public. Got it? And so it varies state to state. We always know that we have so much, ethics is always a piece of nursing. It will be in any field you work in, but hopefully through nursing school, and I feel confident in this, that you guys have been taught ethical decision making, and we will cover that this time. But for your test, I just want you to know that, like, follow your ethics, and your Nurse Practice Act is going to help you with that by protecting the public. Okay, so I don't know if you guys picked up on it, but I emphasized some things several times. I bolded some things in my PowerPoints. I don't share the PowerPoints, and the reason I don't do that is because they're not published, so I can't. But if you want to see them, just put me on mute and go through the PowerPoints like we just did, right? Any questions about the exam? You guys will all get credit for being here. I will send the Zoom log to your professors. Or for my class, I don't know how the other classes do it, but for my classes, all exam reviews will be posted in an announcement. It will update as each one is recorded. Okay. Yes, go ahead, Marcia.
For the math portion, are we
Mhm.
looking at what are we looking at for the math? I was thinking pediatrics for some reason for administering medication, but that's not it, right? I don't really know what's
They're going to be like a
math.
kid weighs
Mhm.
X kilograms, the prescription is blah, blah. How many kilograms per hour? I mean, how many milliliters per hour would you give? That kind of stuff.
Okay, yeah, that's
So
what I
that
was thinking.
calculate with confidence.
Yes.
Yeah. And Caitlin, yes, I'll send this to all your professors. So I'll send a copy of this review as well to professors just to make sure. Everybody gets it. Everyone will have access. You guys have my first and last name. I'm available through email. I'm available through email. So anything you need, I'm happy to help you. Your other professors will have reviews, so don't worry. Dr. Lundy had to cancel hers for tomorrow, just so you know. So double check those. My class, I posted an updated one. So under our announcements, click an updated, whatever, you know, it'll say updated. I don't know how other professors run it, but just run it by them. Make sure our exam reviews, okay? Because it's very important. And I told my classes, and I will tell you guys this, Dr. Brown looks at exam reviews, meaning she will look at who attended. And if you're, she's going to say you didn't attend. Okay. Any questions? Best of luck to you. You guys will do fine. It's your first exam. No, it's your first of 3, and then you have your HESI. Don't stress too much over it. I mean, do your best, study your best, do your reading, listen to reviews, you know, same deal as every other class, right? All right, best of luck to everybody. Anything you need, you reach out to me, okay? Take care and have a good evening.
Thank you.
Thank
Thank
you very
you.
much.
Yep.
Did Professor Lundy reschedule? Or is she going
No,
to?
she's no,
Okay.
she's not available.
Thank you very much.
She has other
Appreciate
ones though. Oh, you're welcome. She has other ones. Look at that list. She just
And they're gonna
canceled
update the
tomorrow's.
times?
Huh?
Sorry, they're gonna update the times on there because I'm like,
I
Are they supposed to-
updated the time, so, and I sent it to all your professors, so they should.
okay,
That was my fault. I did it Mountain Standard Time. I don't know why.
okay,
Okay.
okay.
All right,
Thank
take care.
you.
You're welcome.